Today on V&G, we'll talk about a topic that we often have pet parents, particularly those with Dalmatians, contact us about: urate stones. To start off with, what are urate stones? They are composed of uric acid and its salts, the most common being ammonium urate. You might have heard of uric acid in the context of gout in humans. It's the same compound in animals, and it's a normal breakdown product in the body. Urate stones cannot typically be seen on plain X-rays. So, if there are compatible signs that suggest a urinary tract stone and X-rays are negative, these pets should always be evaluated with an abdominal ultrasound. Another alternative is performing X-rays with the aid of a contrast agent. There is quite a high prevalence in specific breeds, the most common culprits being Dalmatians and Bulldogs. Urate stones form because of elevated levels of uric acid in the urine, or hyperuricosuriia. Other factors that can contribute to the formation of urate stones include having very concentrated urine or highly acidic urine, in other words, a low urine pH. So what causes these increased levels? It is due to either a genetic mutation affecting the transport of uric acid into cells within the liver, or because of an underlying liver disease. The most common liver diseases that we see this with include portosystemic shunts, where blood is shunted past the liver rather than being filtered through it and processed as per normal. In some cases in cats and even in dogs, no underlying cause for the increased uric acid levels in the urine can be identified, and these cases are considered idiopathic, in other words, of an unknown cause. Uric acid is an intermediate product of purine metabolism. While purines are found in virtually all foods, high purine foods are often synonymous with high protein foods, particularly red meat, organ meats, and fish. After uric acid is formed, it is transported to the liver, where it is further metabolized to allantoin. Allantoin has relatively high water solubility and is normally excreted in the urine with no problems. In contrast to this, uric acid is poorly water soluble, especially in acidic urine, and this promotes stone formation. The genetic mutation that leads to hyperuricosuriia involves the gene SLC2A9 with an autosomal recessive inheritance pattern. While the mutation has been well described in Dalmatians and Bulldogs along with Black Russian Terriers, it has also been identified in more than 120 other dog breeds. DNA testing is widely available for this genetic mutation, which can be useful when it comes to breeding dogs from commonly affected breeds and trying to arrive at a diagnosis in a dog already identified as having urate stones. In dogs with urate stones secondary to a genetic mutation, the dissolution of, in other words, dissolving the stone or stones, should always be considered, unless there is some contraindication to either administering dissolution foods or the additional medication needed. If the stone cannot adequately be bathed in modified urine, in the case of urinary obstruction or urethrolyths, this is another contraindication. Dissolution of urate uroliths should not be attempted in dogs with uncorrected liver disease. In other words, portosystemic shunts that haven't been surgically corrected. Usually, the dissolution of urate stones in dogs can be achieved within 4 weeks by doing the following: feeding a purine-restricted, alkalinizing, diuretic diet, plus or minus the administration of a drug called a xanthine oxidase inhibitor, such as allopurinol. In dogs with portosystemic shunts, surgical correction of the shunting vessel should be considered if clinically appropriate. Commercially, the most utilized diet for managing such cases is Hill's UD. Other alternatives include Royal Canin Urinary UC Low Purine Diet and Royal Canin Vegetarian Dry Dog Food. For patients with underlying liver disease, it might be worth considering diets such as Hill's LD or Royal Canin Hepatic. Long-term use of purine-restricted diets might be associated with the development of cardiomyopathy, particularly in English Bulldogs, and this is believed to be either due to a carnitine or taurine deficiency. If you're not interested in feeding a commercial diet, or just looking for alternatives, another option is having recipes for a home-cooked diet formulated by a board-certified veterinary nutritionist. If you're keen to find out more about this, head over to our blog, the link is below, where we discuss how a cottage cheese-based diet recently helped a Dalmatian that was referred to us with recurrent urate urolithiasis. Thanks for watching. If you would like to see more videos like this, please subscribe.